Hey guys, what is up? The remedy that we're going to cover today is called as Trillium Pendulum. Welcome back to Simplified by Jinal Shah, where one more remedy is going to be really simple. I'm sure you must have done this remedy especially in your gynec theraps. If yes, then you know it is a female remedy, most profoundly used for menstrual irregularities and troubles. Uh, Now, let us start first with the word pendulum. To get into the medical college, you must have dealt with physics, and physics has a very interesting topic related to oscillation. And we are going to take the same pendulum and do the whole remedy. Now, if you've been to my channel previously, you know that I take a word, catch and latch onto it, and then explain the whole remedy with that. So, the word for this remedy is going to be pendulum. Now, let us start with something that's very basic and self explanatory. Now, if this is a thread of the pendulum and this is the lower half or the bottom, that is the weight bearing aspect, it is this that keeps the wire taut, correct? So, it's the weight bearing part which keeps the wire taut. Like if there was to be no weight here attached, the wire would be somewhat like this, correct? So what is the correlation here? Why am I saying so much about it? Because the remedy has a constant bearing down feeling, right? Because here it's constantly been borne down by this weight, and the remedy, the female will have a constant bearing down feeling. Now the context is completely different, but you get the point, right? So this is the first part that we go to. Second is, now in the pendulum, or the whole point of oscillation is that when you put in slightest motion, there is going to be movement, correct? So this is the first symptom. The second symptom we could note down is slightest motion, profuse bleeding. I hope it's really easy up until now. Don't worry, just hold on, and you're going to do the complete remedy by just this one figure. Now, since we've come to the part of bleeding, bleeding is at multiple places. We have nose, we have teeth, we have uterus, of course, then we have kidneys and lungs. So these are usually affect or organs of bleeding when it comes to trillium. Then we go on ahead with what sort of bleeding, right? So usually in gynec, you are always going to be grilled about what sort of bleeding. Clinically might not be as important, but it is bright red, profuse, active and passive both. So sometimes you will have not clotted, sometimes you will have clotted bleeding, etc., etc. Right, so let's go ahead with our pendulum analogy. And the other part is that along with the bleeding, the female experiences immense pain, and the pain is mainly in the back, sacrum, and iliac region. She feels as if, I'm going to draw a terribly weird uh, hip bone, but somewhat like this, and it feels like it pains a lot, and she wants to tie it with something. So this is our pendulum here, slightly exaggerated, but it feels like hips and small of back, both of them are falling into pieces and they need to be bound tightly. They need to be bound tightly. So here is where our wire of the pendulum comes to use. This is the third symptom, very important. It's called as sacroiliac pain, very severe sacroiliac pain. Another thing that comes in here is the lochia. Offshoot on suddenly there is going to be severe sanguineous lochia. All right. Now let's move on ahead with the hemorrhagic symptoms. If again this is If I were to draw, maybe this is a fibroid. There is severe hemorrhage due to fibroids, but fibroids not the single reason. Fibroids is one of the reason for menstrual bleeding. Otherwise also there is excessive bleeding. Now what is important and the most important part of this remedy is, which I've taken from Kent, which is menses every 2 weeks and lasts 1 week or even longer. So this is the most important part of the remedy. Menses occur every 2 weeks and lasts 1 week or longer. So common understanding, if somebody is bleeding so much, it is active bleeding, it is profuse bleeding, and it is lasting so long. Anemia, even a layman would be able to answer that she will have anemia. And if she has anemia, even a layman will be able to answer she will have fainting spells. She will have palpitations. Correct? She will have sinking feeling in the pit of stomach. Very common, very simple. This is what the remedy is, but you know it's so simple that you could have derived it on your own as well. Now if I were to just exaggerate a bit, if this is my wire, this is a baby that has come out of the vagina, and you know, right, there is a bladder here. So the symptom is that there is dripping of urine after labor, which is again a very common symptom. So I wouldn't just prescribe on that, but if it had any other symptoms as well. So dripping of urine after labor. Now this smiley faces makes me reminds me about another part of this drug is the family is Smilaceae. How I remember is like if this is a watch usually has a pendulum, put in a smiley face here, and the name is Wake Robin. Okay, so watch usually wakes you up, Smilaceae is the family, and Wake Robin is the name, common name. Correct, so far so good. Now the last important part is about lungs, right? So now count on down things: fainting, palpitations, anemia, loss of blood, prescribed earlier in the days. The only symptom they knew or the disease they knew was TB. It's usually given end of TB when the person is debilitated with anemia and fainting spells. There are suffocatives attack. We'll just write it down here: suffocation, irregular breathing, hemoptysis, expectoration is copious and purulent, that means it is still active infection is going on, and there will be aching. Now this is a sternum, so at the end of the sternum. Correct. Last point, if I were to say, because I said teeth here, after extraction there's going to be immense bleeding. So probably in the comment section you could list down some of the common causes of bleeding disorders, and then we could try to correlate if Trillium Pendulum could work well in somebody with a bleeding disorder. Correct? I guess this is the remedy. I hope I've covered all the points. Please refer to Alan's keynotes for this drug, Trillium Pendulum. That's it. Please like, share, and comment the video if you've liked it, and share it with your friends. Thank you.